Hi everyone, my name is Shanker Pragnaratne. I'm a psychologist and the principal clinician of Prag Consulting.
Hi, my name's Alicia. I'm a social worker and I'm one of the senior associates at Prag Consulting.
And we're talking about positive behaviour support. So what we aim to do for this session is to look at behaviours of concern, understand what we mean when we talk about behaviours of concern, understand positive behaviour support, the principles and the framework for practice, and then we'll look at some practical examples of evidence-based practice, tools and strategies that we can use with families and our clients, and Alicia will take that part of the session. So, behaviours of concern, traditionally known as challenging behaviours also, but these days the preferred terminology is behaviours of concern. So, definitions of behaviours of concern. There are lots of definitions if you look into the research over the past 30 or so years, but the way I would describe behaviours of concern is any behaviour that you're concerned about. However, we do need to be mindful that our own history and our cultural values and such like do influence our judgment, so we need to be objective. The definitions then of behaviours of concern, I use, or we at Prag Consulting, we tend to look at the current practice framework within the DHHS Positive Practice Framework, and in which behaviours of concern are defined as behaviours which prevent the person from participating in their community, behaviours that might undermine directly or indirectly the person's rights, dignity or their quality of life, and behaviours which pose a risk to the health and safety of the person themselves or others. So in practice, behaviours that staff and carers, particularly within foster care settings that we've looked at in the research, have described as challenging, or the most challenging to them are behaviours associated with cognitive difficulties, sexually inappropriate and risk behaviour, aggressive and violent behaviour, and anxiety-related behaviour. So, what then is positive behaviour support? So, positive behaviour support is a system for understanding why people behave the way they do. It's a practical and strengths-based approach to working positively with people, addressing quality of life, personal interests and priorities, and in more formal settings, in our care settings, looking at also or being mindful of ethical issues such as safety and risk, quality of life, duty of care, prevention of abuse, and effective support interventions. Positive behaviour support blends human rights principles and humanistic values with practical science about how learning and behaviour change occur. So if we look at some of the principles that underpin positive behaviour support from those human rights, humanistic and practical science contexts, the principles might be that every person is unique and has a right to be treated with dignity and respect. Every person has the potential to learn, change, grow and develop. That's a humanistic value that underpins positive behaviour support. And people express their needs in any way they can, at times when the necessary conditions are missing, or for example, lack of opportunity or limited skills and abilities in the person. The expression of that need happens in maladaptive means, or what we call behaviours of concern. So the positive behaviour support model in practice, then if you look at the framework that we follow, what's on your screen at the moment, we always start with an assessment and to try and gain a thorough understanding of the person through looking at their history, and their cultural and developmental history and family history and all those sorts of things. Developing then trying to work with the person and their support networks to try and develop a positive relationship and a rapport, and an understanding the purpose and meaning of the person's behaviours through that relationship. The framework then includes, we start with proactive strategies, or what we term positive preventative strategies, which include in the main three components: changing the environment, that is looking at the ecological, what we call the ecological strategies, then teaching replacement skills, so which is also known as positive programming, if you like, skill teaching, and then looking at short-term change strategies for rapid behaviour change. So where we anticipate behaviours, and we know, if we know the triggers and the settings for that behaviour, we look to try and address those to prevent behaviours of concern from happening. But these are just short-term strategies that don't lead to long-term change necessarily, because to address long-term behavioural change, we do need to understand the function of the behaviour, or the purpose and the meaning of the behaviour for the person. Okay, and then we look at response strategies, or what is also known as reactive strategies, but we like to think of them as response strategies, because we need to be planned and prepared with a support plan to address even those behaviours of concern that do come up. Even when we do get things right, now and then behaviours of concern do come up at the face of stress or anxiety for the person at different times, and then we need to have some tried and tested strategies to be able to address those behaviours of concern, and they're the response strategies. So within that framework, to assess and understand behaviours of concern, we have a set of principles again. All behaviours serve a function or a purpose for the person, and behaviours of concern are generally difficult to change because they serve that function or the purpose for the person. Our job, therefore, is to find out what that is before intervening in people's lives. We need to understand what the function and the purpose the behaviour serves the person before we try to change any behaviours or any conditions for that person. And the most beneficial way to understand behaviours of concern is through a functional behavioural assessment. Okay, so through research into this area, we know that behavioural functions generally fall into 4 or 5 categories, and the most common behavioural functions that we've come across are communication, so to serve a communication or an expressive function, the person needs to express a need or a concern or a protest, so that is a communication function. Or to acquire something, either tangible or non-tangible, for example, an activity, or gain access to a place, or even just validation. That would be a non-tangible function or non-tangible gain. Social attention, acknowledgement, autonomy, control, all of those things serve the acquisition function. Or escape and avoidance function, that's another function, for example, from physical or emotional pain, or from punishment and such like. Then there is also certain physical or sensory needs that drive behaviour as well. For example, hunger, pain, such like, but also where there might be some specific sensory deficits or sensory needs. For example, low registering of certain sensations can lead to sensory seeking behavior, or high registration or sensitivity and aversions to certain stimuli can also lead to certain other types of behavior or avoidance of those sensory sensations. And then for coping and regulation as well. People use certain behaviors of concern to deal with and to cope with anxiety or stress or their traumatic experiences and such like. So behavior can't be explained by a single factor or attributed to a single reason or cause. Usually critical hidden factors, what we call background factors or setting events, those factors that set the person up to behave in a certain way, underlie and drive the behaviors that we see. So typical setting events are those historic and internal or external factors to the person, but typical setting events might include physical, medical, sensory and neurological factors that underlie or that cause the person to behave in certain ways, psychiatric and psychological factors such as anxiety, depression, loss and grief, or even psychosis that cause certain behaviors that are related to those specific psychiatric conditions perhaps, and certain specific syndromes also underlie certain presentations, behavioural presentations, through what we call syndrome-specific features to those syndromes, such as, for example, autism, Down syndrome, and those syndromes that we are fairly familiar with in the disability sector, Rett syndrome, Klinefelter's, those sorts of conditions have their own specific features, behavioural features that are associated with those syndromes. Then there are those very common communication and behaviours related to communication deficits or limitations in communications, which I think cause perhaps, as we see it, perhaps 90% of behavioural conditions are due to communication limitations in people. Commonly boredom and lack of any meaningful activities, lack of any meaningful participation in life also underlie behavioural presentations or cause behaviours of concern, and personal and social issues such as certain experiences of abuse, bullying, trauma experiences and such like. And typical triggers, now when we talk about settings and triggers, they tend to they do tend to sort of overlap sometimes, but typically what we mean when we say triggers are those very immediate things or in the immediate preceding antecedental conditions, if you like, to behaviour, so which is what we call proximal or immediate triggers, and those setting factors that I mentioned earlier are generally what we call distal triggers. They're in the distant, they're in the background. So typical triggers for behaviours also include internal causes, for example, some acute pain or illness, or even psychiatric phenomena again. Environmental conditions, typically over or under stimulation from the environment. So for example, noise, anxiety stimuli, or not having enough stimuli from the environment can also cause behaviours in some people. Communication again is a typical trigger when someone is misunderstood, for example, or being not heard or feeling like they're not heard or understood, leading to frustration, can cause certain behaviours, as we all probably know. Then things that we are not even aware of sometimes, such as our interpersonal interactions and some of the dynamics in our interpersonal relationships can cause behaviours of concern just because of certain if you like, breaches of basic human rights. For example, things that lead to mistrust, things that lead to frustration, things that lead to protest from the person, which are then seen as defiance or even aggression and anger by others. There are also probably power struggles that within those interpersonal interactions that also cause frustration and defiance, like behaviours that are in defiance or in protest by the person. And of course there are typically unmet needs that also trigger behaviour. So usually they're very basic needs that are unmet, that we haven't yet identified or don't pay enough attention to. Therefore the person has to behaviourally act out, especially if they don't have the communication capacity to express their needs to their family or their communication partners. Boredom and inactivity also again are typical triggers where the person is left to their own devices or have lack of purpose and meaning in their day or in their life. Typically we also know and we see warning signs for behavioural presentations, which are really important in sort of trying to address behaviours of concern from escalating to those really difficult or crisis type situation. So if we, what we try to do is through understanding the person and through our assessments and observations and such like, we try to understand the warning signs, the early warning signs of behaviour, and those are usually known and observable signs to watch out for, which then indicate the likelihood of a behavioural episode happening. For example, if a person might be withdrawing, there might be some anxiety type behaviours, repetitive questioning, facial expressions, grimacing, whatever that the person is known to do, as a warning to their behavioural cycle or the escalation cycle. Mood changes, pacing, overactive or underactive, difficulty attending to tasks and such like. All of those can be warning signs, but you might know other warning signs that we haven't mentioned here. It is really critical that we understand those early warning signs so that we can intervene at the right time and offer the right support to the person. So within the functional assessment process, we also want to understand what's maintaining the behaviour, what is the person trying to achieve or gain from using behaviours of concern. We call these maintaining factors for behaviours of concern. Usually they are either rewards or consequences that the person might be looking for through using the behaviours of concern. They might come in forms of, say, certain interactions that they're looking for, desired activities or desired social interactions, or certain tangible gains. So now that we've looked at maintaining factors for behaviours of concern, let's look at what we consider antecedent control strategies, how to intervene at the right time to change the conditions that lead to behaviours of condition or change those triggering events for behaviours of concern, such as environmental factors or routines, internal causes or people and their relationships and dynamics that we know lead to behaviours of concern. So if we address those antecedent events and come in at the right time to change those antecedent events, then we are reducing the likelihood of behaviours occurring or escalating to a crisis-like point. If they do, however, keep escalating and they hit that point where it is a crisis or a full-blown behavioural episode, that's when we need to have those response strategies to come in with the tried and tested and known strategies that work to calm the person or to be able to redirect the person to their baseline or to their personal best, if you like. Now we'll look at a case example from our practice, and I'll hand over to Alicia to discuss a case example with an intervention plan that Alicia has used with a family that she has worked with a young person and a family that she has worked with. Over to you.
So we're now going to look at an actual example from practice which puts some perspective around the things that Shanker has spoken about in terms of PBS and how we formulate our intervention and what sort of strategies and supports that we use. So we're going to use the example of a young boy by the name of Andy, and Andy is a 13-year-old young person with a diagnosis of autism spectrum disorder and intellectual disability. He's in the sort of moderate range in terms of his intellectual disability, and he's largely non-verbal with limited functional communication. So Andy lives with his mum, who's a single parent, and they have very limited formal and informal supports available. Andy was referred to Prag Consulting for a range of challenging behaviours, including school refusal, hitting, pushing, and property damage. And at the time of referral, Andy was refusing to attend school, and he was refusing to leave the house into any community settings or any previous activities he was engaged in. So it was complete refusal, essentially, to leave the home. So Mum was trying to work with him, and the school was trying to work with him to manage his behaviour, and they were doing this through coaxing him out with rewards such as using the iPad or offering his favourite food, and this had varied and limited success. More often it resulted in significant emotional distress for Andy and for his family as well, and it sort of reinforced the anxiety that he was experiencing outside of the family home, and then the refusal to leave the family home would increase as a result of that. So, as Shanker has described, the first thing that we need to do is a functional behavioural analysis. We need to understand the person we're working with, and we need to understand what's driving the behaviour. So we completed that analysis, and this analysis revealed that Andy was experiencing significant challenges in his receptive and his expressive communication, and along with severe anxiety that was impacting on his ability to interact with others and his environment. So one of the goals of our behavioural intervention was to look at how can we improve the information that was being communicated to Andy, and the aim of that was to reduce the anxiety that he was experiencing, which was largely caused by uncertainty and lack of predictability in his environment. And we did this through the use of visual aids. So what are visual aids? We've got some slides that will be up for you to have a look at, but visual aids are essentially photographs, drawings, written words or lists that are used to support understanding and communication. And we can use them in a variety of ways to communicate information and to teach new skills. They're particularly effective as they reduce uncertainty and confusion in communication, and you can re-refer to them. They can be referred back to as necessary. So unlike in verbal communication where we might miss key information or misinterpret the information that's being communicated to us. The first of the visual aids that we used with Andy was a simple first and then board. And a first and then board is a visual display of a two-step plan. So it's often used to support the transition from a non-preferred task to a preferred task, or they can be used to help communicate expectations, reducing confusion and misinterpretation. So in our intervention with Andy, we started with a first and then board, and we focused by looking at things that he already enjoyed doing. So when we introduce a new strategy, we want to create a very strong positive association with that strategy or that tool. So the way that we did that was we looked at the things that he liked, and we used the board to transition from one activity that he liked to another activity that he also liked. He loved jigsaws, and he was very good at 1,000-piece jigsaw puzzles. So we did jigsaw puzzles, and then we did iPad, which were two things that he really enjoyed doing. And through that process, he understood the expectation, he was able to manage the transition, and there was a strong positive connection between what we were asking him to do and the outcome. So the other good part about a first and end board is it's a great introduction to a more complex visual schedule. So it just sets the groundwork and the framework for more complex visual schedules. So a visual schedule is a visual representation of what's going to happen throughout the day, on any given day, or for the week. So they're helpful in decreasing anxiety and reducing uncertainty by communicating when certain activities or events will occur throughout the week or on any given day. They can also be used to break down steps of a more complex task through aiding understanding and mastery of the skill. So visual schedules were used to support Andy's understanding of the days of the week and what would happen on any given day. So that gave him routine and predictability, and we were able to communicate with him any changes in that routine as well, which reduced his anxiety and the uncertainty. So this was quite an involved process, and there were other strategies that we implemented as part of this, which was graded exposure to certain places in the community and his school environment once again. But we started with the basics of 2 things that he liked to do, and then we stretched that to school, jigsaw, and then home again. And we did this over a significant period of time, about a 6-month period of time, and eventually it led to him re-engaging in a full day of school and learning without distress or refusal. So one of the other strategies that we use is something called a social story, and again it's an extension upon a visual schedule or a visual script. So a social story is an individualised short story that depicts a social situation that your child might encounter. So they're designed to provide key information about an event or setting, and they're written from the child's perspective using language that's appropriate to their individual and to their language skill level. So they use a lot of descriptive sentences such as who, what, where and why to explain what's going to happen. And they also outline what's expected of the child and what the child can expect from others. And again, the more information that we give, the more that helps them to understand what's going to happen, when's it going to happen, what's expected of them, what's expected of others, and it just reduces that anxiety overall. So social stories should also include our response strategies, which Shanker's touched on before. So our response strategies are the agreed actions on how the child will be supported during the event. And those are generally derived from what we know of the child, what they like, what their preferences are, what are the things that calm the child that we know of. So we did use many social stories over the course of support with Andy to re-engage him in community activities. And we'll give you an example of one that was used to help him when he was attending a local cafe. There's a cafe that he liked to attend down the road with his mum, and he would enter into the cafe and he would choose a number of things that he wanted to eat. Sometimes he would change his mind, and sometimes he would take food from other people's plates in the cafe while he was waiting for his own meals to be delivered, which caused Mum a lot of embarrassment and distress, as you can imagine. So we use social stories to help manage that behaviour. So the social story that we used, which you'll see on your screen, just describes the W, so the descriptive sentences as we've talked about. So where am I going? Who am I going with? What happens when I get there? It's also talking about sort of choice and control. So what can I choose? But we're also setting limitations. What's the boundaries of that choice? How can I manage in that situation if I'm feeling stressed and overwhelmed? So Mum's going to bring the iPad, which we know is a calming strategy for Andy, and he can watch Dora, which is his favourite show to watch. There's always a range of factors that we need to consider, and Shanker mentioned this earlier on. There were a lot of sensory components that we needed to consider with Andy as well. So he found busy places and noises quite confronting. So we would think about the environmental changes as well. We would sit towards the back of the cafe where it was quieter. It was an outdoor setting. There were less people around, away from noisy coffee machines and things like that. And as Shanker was saying, that sort of sets it up to be successful for the young person in that environment. We did also talk about the expectations, and the expectations of Andy in that setting was that he was to wait until everybody had finished eating. He had a tendency, once he'd finished eating, to get up and say, okay, well, I'm done and I need to go. And that's just a lack of his understanding about what happens in that sort of social setting, that it's a social event, that we sit and we talk and we share that meal together. So in his mind it was, I've finished my lunch, it's time to go. So over time he was able to sit and wait so that Mum was able to actually finish her lunch in that setting, which made a huge difference for her. So in summary, if we're looking at the aims of our intervention and support, the aims are to identify the factors that predict the behaviours of concern and understand their purpose. Most importantly, we want to identify functionally equivalent replacement behaviour for better adaptive pro-social behaviour. And we do this through the development of effective positive behaviour support, preventative and response strategies. And our overall aim is to improve the quality of life of the participants that we work with.
So that's brought us to the end of our presentation proper. We hope you enjoyed it. We hope it was useful. And now, Alicia and myself will stick around to take your questions.